pain to your thumb after work? Well, it's really common. It's often what we call repetitive strain-based injury, where if you're doing a job where you're either doing a lot of typing at the desk or very manual work, the tendons and the muscles to the wrist and the hand can overwork, get injured and then inflamed, and that's why we get pain. The challenge is once they're inflamed, they get quite weak, and then it's more irritable the more you use it, so it can become a vicious cycle. So step one, to start to relieve your pain, we actually want to get rid of the localized inflammation. So I would encourage you to use hot and cold to the area little and often, 5-10 minutes on and off throughout the day for the first 5 to 7 days. It's not to get rid of pain, it's to try and get rid of inflammation. The other thing to consider is anti-inflammatories, but just make sure you can take it with your other medications. And then thinking about loosening off all the muscles to your forearm. Now, the easiest way to do this is get a bit of oil, use your knuckle, and then press down and try and get into that muscle, or just wiggling the muscle back and forwards like that. Or you can also get a massage gun, which is an electric massager that can just go up and down and loosen that area off. Then what you want to do is what we call isometric. So wherever you're getting the pain, which most commonly is the thumb, you just want to literally not move it, but imagine you're pushing the thumb upwards, but your other hand is stopping. So push against, hold for 5, 4, 3, 2, 1, and relax. You don't have to do it in an awkward position like I am now. You can just do it relaxed in a chair in any position, little and often, and that's to just keep the muscles active whilst they're acutely healing. Once things start to improve, it's then about starting to regain movement, because you'll find that any movement initially is painful. So during that time, try and not aggravate, allow it to rest, and don't do too much with it. Once that pain starts to settle, it's then quite simply, can I raise up? Can I raise down? Can I raise up? Can I raise down? And can I reach to each finger or even lower down? Again, it's just starting to rebuild movement. And then finally, you actually want to add in some strengthening. So this is where you're actually doing something with a bit of resistance. So either using your finger or a resistance band to actually move the thumb up and down, and the wrist as well. So can we move the wrist up, move the wrist down against a bit of resistance to start to rebuild some strength. If we don't rebuild the strength, the injury often comes back and it becomes a vicious cycle. So step one, get rid of inflammation, settle it down. Step two, regain normal movement to the thumb, to the wrist, wherever is hurting. And then step three, add in strength and load so it can cope with your daily activities.